Hi friends. Did you know insurance companies are using artificial intelligence not to generate text or images? It's generating denials and profits. Let me show you how this is affecting your healthcare every day. I'm David, lead pharmacist at MyRxPro. Every day I see insurance denials for routine care, life-saving therapies, even life-saving therapies. Denials for no legitimate reason. These are excuses that would get a first-year pharmacy student an F. Let me tell you about prior authorizations. Prior authorizations is insurance's way of putting paperwork between you and the treatment your doctor prescribed. Insurance puts up these barriers for anything that costs money. And if you don't think this will ever happen to you, well, Biologics are one of the fastest growing pharmaceuticals. This is for two reasons. First, they are amazing drugs. This relatively new class of medications are proteins, cellular components, enzymes, antibodies with strong biological activities. Because they are large molecules, they generally require an injection. This class of medications has revolutionized several diseases. Crohn's disease, rheumatoid arthritis, multiple sclerosis. Even though you might not be using any of them now, these powerful medications are only going to become more and more common in the future. And you could be in need of one sooner than you think. The second reason pharmaceutical companies are developing them, these medications are expensive and more profitable. So even though many of them are highly effective, insurance will deny them. And this isn't the only treatment that insurance will deny. They deny anything that costs them money. Physical therapy, MRI, post-op rehabilitation, critical cancer screenings, anything that cuts into their bottom line. And how are they handling this massive volume of denials? They automate it. Instead of a real medical director carefully reviewing your medical records, insurance are feeding prior authorization requests into AI algorithms. These systems scan people's files, issue rejections in as little as 1.2 seconds per claim. A doctor spends 12 years in medical training learning how to save your life, and a computer program overruled them in less time than it takes to type out denied. Here is the dirtiest secret in the health insurance industry. They are counting on you giving up. Fewer than 1% of patients ever appeal a denied claim. So when the algorithm automatically stamps denied, the insurer keeps your money, avoids paying your treatment, and pockets the difference as profit. Let me show you in a real example. Let's say your parent has a stroke. They need physical therapy to recover their ability to walk. Their nursing home provides the therapy. Then you get a letter from the insurer, claim denied, not medically necessary. But their doctor said they do need the therapy. So who made the denial decision? Artificial intelligence made the decision to deny. And here's what's disturbing. The algorithm isn't designed to determine medical necessity. It's designed to deny claims at mass scale. They are betting that you don't appeal the decision. Here's a real case. Cigna's AI algorithm was called PXDX, and it was automatically denying claims. Not carefully reviewing them, it was automatically denying them. A medical director would then rubber stamp the denial. On average, they spent 1.2 seconds per claim. 1.2 seconds. In 2 months, this algorithm auto-denied 300,000 claims. When journalists and regulators reviewed these denials, they found legitimate claims being denied. AI making decisions without sufficient medical information, medical directors rubber stamping those denials without actually reviewing them, and patients and doctors fighting to overturn decisions. In my clinical experience, this isn't a mistake. This is their business model. UnitedHealth uses an AI algorithm called NHPredict to determine exactly how long your parent would stay in a rehabilitation facility. The algorithm calculates a statistical average. It looks at a database and says patients like your parents typically only needs 14 days of rehabilitation. So right on cue, UnitedHealth denies payments after 14 days. Even if your parent's physical therapist is standing right there saying your parent still cannot walk safely, they are a massive fall risk, they need more therapy, the algorithm completely overrides the human doctor. Now, how do we know this? How do we know the inner workings of this corporate machine? Because the curtain was just pulled back. On March 9, 2026, a federal judge in Minnesota dealt a massive blow to UnitedHealthcare Group in an ongoing class action lawsuit. The court legally forced the insurance giant to open up its private proprietary data and hand over nearly a decade's worth of hidden internal files, data and files they never thought the public would see. The judge ordered UnitedHealthcare to turn over their internal AI design specifications, their secret guidelines for post-acute care, and most shockingly, the performance evaluations and compensation records for those medical directors. Medical directors are the doctors making the final decisions. Sometimes they are not making decisions at all. The courts are actively investigating whether human reviewers were financially incentivized or pressured to rubber stamp the AI's cost-cutting rejections over a doctor's real-world judgment. And while this legal war plays out in federal court, the actual impact hits your family in the hospital room today. Vulnerable patients are being prematurely kicked out of rehabilitation facilities while they are still unable to care for themselves. We are seeing entirely preventable readmissions to hospitals because the seniors are being discharged too early. And exhausted families are being forced to suddenly pay thousands of dollars out of pocket, or take their parents home completely unprepared for the physical burden. The algorithm doesn't care about your parents' actual recovery. It doesn't care that you haven't been trained to transfer your parents safely from the bed to the toilet without dropping them. It cares only about the exact calendar date the computer program decided to cut off the money. Now here's the question everyone asks. How is this legal? Why are they denying so much legitimate care? The answer is terrifyingly simple. They are betting that you will not appeal. Approximately 0.2% of denied insurance claims are appealed by patients or their families. This study by the Kaiser Family Foundation showed that if insurance denies 1,000 claims,
only 2 people will appeal.
That's only 1 appeal for every 50,000 denials. Why does this matter? Insurance companies are already studying this. They have already known this for a long time, and they are using it against you. They know you're exhausted. You're working full-time and managing your parents' care. You're running on empty. They know that when a claim is denied, you'll have to read their denial, understand why it was denied, gather medical documentation, call the doctor to get them to challenge the denial, navigate the appeal process, and wait weeks or months for a decision. Most people give up, and insurance knows it. Let me show you the math. Let's say an insurance company denies 10,000 claims per month. Let's say 80% of those denials are for medically necessary care that should be provided. That's 80,000 illegitimate denials. If 0.2% appeals, that's only 16 appeals. The insurance company might lose on 10 of those appeals and have to pay claims, but they kept the money from the other 9,984 illegitimate denials. Insurance companies are deliberately denying legitimate claims because they know most people are too exhausted to fight back. They are monetizing your burnout. The system is betting that you simply are too tired to fight back. And honestly, you have every right to be tired. You aren't trying to change the world. You are just trying to keep your parents safe. But when you receive an automated insurance denial, they are counting on you giving up and pulling out your own credit card to pay out of pocket. But here is my practical advice on how to fight back against the AI insurance denials. When a Medicare Advantage plan or commercial insurer issues an automated denial, they hide the true justification inside a dense 150-page legal contract called the Evidence of Coverage, the EOC. They assume you will never read it. And don't worry, you don't need to. You can fight their AI denials with an AI tool of your own. This document contains 0 personal health information or private data. Uploading this generic policy handbook to a public chatbot completely bypasses all HIPAA and privacy concerns. Drop the policy PDF into ChatGPT or Claude or Gemini and paste this exact phrase, quote, "Analyze this insurance policy handbook. Give me the exact step-by-step instructions on how to file an administrative appeal for a physical therapy denial in a skilled nursing facility following a Medicare qualified hospital admission. Identify the strict filing deadlines and the exact contractual language they use to define medical necessity for rehabilitation." and the precise fax number or mailing address where this appeal must be sent to." End quote. Now, because these documents are so large, there are possibilities of the AI hallucinating. So always confirm that you are following the correct process so you don't miss out on any deadlines. If this is too daunting for you, schedule a quick 15-minute call with me. We can review the denial. I can give you the exact phrases to use. I can even review your response to make sure it's 100% accurate. Link is in the description. And while you're standing up for your loved one, let me remind you to grab a copy of my new book, Fewer Pills, More Pause. I wrote this as your practical guide to navigate a healthcare system that was simply not built for an 84-year-old or family members trying to protect them. It's packed with actionable advice to help you cut through red tape, avoid unnecessary medication, and advocate for the dignity and care your parents deserve. You can follow the direct links in the description. If this video gave you clarity, share this video with a friend, a coworker, or a caregiver who is currently exhausted and trying to navigate a denial claim. You are not crazy and you are not powerless. You don't have to fight the system alone. I'm David, lead pharmacist at MyRxPro. Let's keep them safe, one pill at a time. Thanks for watching, and I'll see you in the next video.